everybody, this is Kelly with Norman Regional. This month we are doing a series of Facebook videos tackling the issue of mental health. It's something we really want to just tackle straight on and end the stigma and help people really get to the resources, information, and medical help that they need. Here to talk to us about it today is Dr. Farhan Jawed, psychiatrist and medical director of Norman Regional's Behavioral Medicine Services. Thank you. So when it comes to mental health, we've talked a lot about, depression's pretty common, but there are instances where there are emergencies related to mental health. There are crisis situations. How do you handle that?
Well, that's a very important question, and I often asked this question, how to deal with these situations. Just like medical emergencies, there are psychiatric emergencies. Those are the situations where someone can be a threat to themselves or somebody else. So if you are in a situation where a family member or even a stranger, where there is a situation they look like they're going to harm themselves or somebody else, or they are talking about wanting to harm themselves or someone else, or in certain situations they may not be in the right state of mind because of their mental health issues such as schizophrenia, where people can have delusions, hallucinations, paranoia. So in those sort of situations, that person needs to be brought to an ER. And in most situations, the ER is supposed to help the patient, and they can place that patient into a mental health facility where they can be taken care of, as they are a threat to their safety and they need a safe place. We are fortunate that here in Norman, at Norman Regional Porter campus, we have our own inpatient psychiatric unit. It is a 20-bed unit where we admit people who are a threat to their safety. We provide them with initial psychiatric evaluations. We have board certified psychiatrists such as myself who do a complete psychiatric evaluation. Then we discuss and decide what medicines they need, and if there are changes needed to their treatment and medication, we provide that. Along with that, since they are staying there, we have a very comprehensive program where we provide them with a lot of counseling as well. So we provide them with group counseling sessions, individual counseling, there's activity therapies, craft therapies, meditation therapies, sports therapies, and they get to see their own social worker case manager who is responsible for making sure that when they are ready for discharge, all of their follow-up appointments are set. So whenever somebody's treatment is completed, we discharge them with 30 days of medicines. We set them up with a psychiatrist, psychologist, their medical doctors. We make sure all the follow-up appointments are completed, and then we discharge them.
So you're really putting them on the road to success.
We make sure that we take care of the acute situation, and they have the resources outside so that they continue to get the continuity of care.
So this is an inpatient facility. How long do patients typically stay for treatment? I'm sure it varies.
Well, usually the average stay is about 4 to 5 days, but depending upon the severity of the situation, some people may need to stay longer and some people stay less.
Okay. And then they transition to outpatient care. And what are some of the things that are important when they are transitioning from inpatient to outpatient? I would think family support is important.
The most important that I always tell people is compliance. So when we discharge patients, we always provide them with medication. All they need to do is continue those medication until they go and see their psychiatrist or the provider who they are set with. So that way they will be covered for the time period where they're out of the hospital and they're going into a new person.
But they've got to go to that follow-up appointment to get that refill.
Yes, because once they're discharged from the hospital, then we have taken care of their immediate needs. Now for the continuity of care, the outpatient physician's responsibility is to continue to help them.
Okay, this was great information. Thank you so much for sharing that with us. Thanks for watching, guys. Please share and comment and like this video so more people can hear about all the resources available to those dealing with mental health issues.